Penny Spellberg had been under stress. She lost her job after spending years working 60 hours a week in the food industry, on top of raising 2 children. One January morning, her fatigue became so bad, she ended up in the emergency room at Beth Israel Deaconess Hospital, Milton.
I knew that there was something wrong, something very wrong, but I couldn't identify it.
Dr. Jonathan Anderson was on duty that day. He says 30,000 patients come through the doors here each year, from newborns to centenarians. The ED sees about 4 or 5 cases a day like Penny's, complaints of vague symptoms that make a diagnosis difficult.
It's one of the bigger challenges in the ER. You only have maybe 30 or 60 seconds up front to convince them both that you know what you're doing and that you care about them, unlike a primary doctor who's seen them repeatedly for years. And there's some tricks you can try, but I mean, the important thing to do is to care about them, to sit down in the room and actually give them a few seconds and listen to them.
Penny was a vegetarian, she told the doctor, with no relevant family history of illness. But after asking the right questions, Dr. Anderson learned her breathing seemed to get worse when she climbed a flight of stairs. Dr. Anderson ordered a series of tests.
They saw immediately that my cholesterol and blood sugar were extremely high, and they admitted me right away and told me that I had high cholesterol and diabetes, which was shocking to me, shocking.
And in her case, the recommendation was she stay here and see a couple more doctors, see a cardiologist, and consider some stress testing or further provocative testing to kind of get to the bottom of it.
The next morning, the stress test and an echocardiogram were performed under the direction of Milton cardiologist Dr. John Cronin. It pointed to more bad news. Penny was immediately rushed to the Cardiovascular Institute at Beth Israel Deaconess Medical Center in Boston.
It turned out that she did not have a heart attack, but the stress test showed a significant abnormality. And immediately after the stress test on that same day, she was transferred to our facility so we could proceed with cardiac catheterization.
Because BID-Milton is in the same system as BIDMC, Dr. David Lehman pulled up Penny's medical records from Milton as soon as he learned about the case, and he prepared for an emergency cardiac catheterization to see if blood was flowing properly to Penny's heart.
The cardiac catheterization did show that she had a significant narrowing in one of the 3 arteries that supply the heart with blood, the right coronary artery. We were able to fix the narrowing with a stent procedure and discharge her the next day.
The whole thing was brilliantly executed, I thought. Everybody was so nice and so knowledgeable. Also, what I appreciated was they did not release me until 2 people from Joslin Clinic came and educated me as to what diabetes is, how to eat properly, how to administer insulin. So I was extremely appreciative and in awe of the care that I was given.
Each week, there are dozens of cases in which BID-Milton clinicians collaborate with those at BID Boston, cases like Penny's.
She didn't need to go to a tertiary center immediately, but she needed further testing that can be done in her hometown, in her community, by a specialist who works and lives here. And that's what was done, and her case was one where the testing was positive, and thus she could be rapidly sent downtown for an intervention that would, prolong and basically restore her life.
We do look upon the doctors at Beth Israel Deaconess Milton as our colleagues, and when they want to transfer patients to us for more advanced or tertiary care, they know exactly who to call so that the transfer can be done very smoothly with very little loss of time.
Today, Penny is back to herself. She has shared her story with her Facebook community, along with reminders about the importance of taking care of yourself, no matter how busy you may be. She's also walking and swimming regularly.
I was so extremely grateful, and still am extremely grateful, for the care that I was given at Milton Hospital. I was taken very seriously, even though there was not one specific problem that I could identify. The relationship between the hospital in Milton and the hospital in Boston is a wonderful one to have, it, and the fact that there are resources for each other is very comforting to know.